everyone. Today I'm going to tell you how to approach a case of hepatosplenomegaly. So today you will learn GIT examination for the liver and spleen. When you will label the normal liver and spleen, what is the grading system for palpable splenomegaly? What is the difference between visceroptosis versus organomegaly? How to approach isolated hepatomegaly, approach to hepatomegaly with the mild splenomegaly, and approach to isolated splenomegaly or splenohepatomegaly, and approach to hepatosplenomegaly. So first objective is how to palpate the liver. So in this video you can see there are four prerequisites for the liver and spleen palpation. First is child should be in supine position and knee joint should be flexed, and we should stand on the right side of the patient. We should warm our hands before palpating, and we should tell the child to take the deep breath. So organs, whatever enlarged, will be palpable easily. So see in this video and start from the right iliac fossa for the liver palpation, and we have to keep our finger flat over the abdomen and we have to move toward the right hypochondrium. So here in this video you can see I am palpating for the liver, and now the liver border is palpable. So when liver is palpable, we have to mark that side. So I am marking, this is the liver border which is palpable. So this is the classical method for the liver palpation. Now there is a hooking method. If liver is small size, not able to you palpate in the classical method, then you can use this method. So see in this video, this is hooking method. Just we have to hook our finger uh, in subcostal area. So this is hooking method for the liver palpation. Now another is the dipping method. Whenever child is having ascites and you are not able to feel the enlarged liver, then you can use your both finger and you have to press just like a dip. So see in this video, this is dipping method. We will start from the right iliac fossa and we will move upward toward the right hypochondrium as in the classical, but we will use both the hands and we will do just like we are doing the dipping. We will apply the more pressure. Now once the liver is palpable, then you have to see all the points. You have to see the size of liver, consistency, surface, margin and tenderness. So for the size, below subcostal margin in the mid clavicular line, you have to take the size, and then you have to check the consistency, surface, margin and tenderness is there or not. Now I am performing for the liver span. So in this we have to percuss from the second intercostal space. We will start the percussion. Once the resonant node will be converted into the dull node, here in this space it is converted into the dull node, so it is the upper border of the liver. We will mark this side also, and we will take the distance between upper border and the lower border in the mid clavicular line. So 10 centimeter is the liver span of this child. Now whenever you are palpating for the liver, we have to keep in mind, is it actually liver or any other organ. So in this video you can see I am confirming is it liver or other organ enlargement. So if you are not able to insinuate your finger between the subcostal margin and the organ, that means it is the liver, and then you have to keep your finger at the border of liver and tell the child to take the deep respiration. If organ is moving with the respiration, means it is liver, not any other organ. So these are the two methods to differentiate liver versus any other abdominal mass. First is finger insinuation and second is just keep your finger over the lower border of liver and liver will move with the respiration because liver and spleen are attached with the diaphragm, while other any abdominal mass which is originating from the intestine or kidney, it will it is not attached with the diaphragm, so it will not move with the respiration. Now similarly for the spleen palpation, classical hooking and dipping methods are there. So in the classical method, we have to start from the right iliac fossa, then we have to move towards the left hypochondrium, and once the spleen is palpable, we have to mark the side. So here I am performing classical method for the spleen palpation. In hooking method, we have to keep the baby in right lateral position. In this video you can see, and we have to hook our finger in the subcostal area whenever spleen is very small in size, not able to palpate by the classical method, then we can use this method. Now the third one is dipping method. Whenever having the ascites and spleen is not palpable, then you can use this method. So see in this video, I am doing the dipping method for the spleen palpation. Start from right iliac fossa and move towards the left hypochondrium. Now similarly for the spleen also, we have to check the size, consistency, surface, border and also notch in the spleen border. So I am taking the size in mid-clavicular line below subcostal margin. So this is 5 centimeter, spleen is enlarged. Now we have to feel for the consistency, surface and margin or border, and also feel for the splenic notch and see the tenderness also. Now about the normal liver. Liver normally palpable up to 2 centimeter below right costal margin till 4 years of age, and 1 centimeter palpable below right costal margin till 12 years of age in children. We should also keep in mind that up to 2 centimeter is normal in 4 years age, and up to 1 centimeter till 12 years age we consider as a normal liver, and after 12 years it should not be palpable. Now the normal liver span, normally upper border of liver, when we are percussing for the liver span, fifth intercostal space in mid-clavicular line, seventh intercostal space in mid-axillary line, and ninth intercostal space in scapular line, liver will be, when we will percuss, upper border will be feel. Now normal liver span at birth it is 4.5 to 5 centimeter. At 2 months it become 5 to 6 centimeter. At 12 months of age 6 to 7 centimeter. And 1 to 4 years of age 7 to 8 centimeter. And 5 to 12 years of age it is 8 to 9 centimeter. So as I explained how to palpate for the liver span, the child was 7 years old and having the 10 centimeter liver span and having the hepatomegaly. So that means it is more than normal range. Above 12 years age, it is 10 to 11 centimeter. So to remember the liver span, just you have to remember at least these three figures. 3 months, 6 centimeter, just double. 4 years, 8 centimeter, just double. And 9 years, 9 centimeter. So remember by this trick, and below this age just decrease 1 centimeter, and above this in between just increase. So you can easily answer whenever asked in the viva what is the normal liver span according to the age. So just remember at least these few figure. Now normal liver is non-tender, consistency soft, surface is smooth, margin is smooth and round. Now about the normal spleen. Spleen may be normally palpable in 30% newborns and 15% infant. Normal spleen dullness will be in 9th, 10th and 11th left intercostal space in mid-axillary line. Now the other objectives of this lecture I will cover in the next video. Thank you so much.